There's currently an outbreak of Ebola in the Democratic Republic of Congo and an outbreak of measles not only here in the States but also in Europe. Keeping that in mind, it's been pointed out that the initial symptoms of both of these viral illnesses have much in common. Of course, you're probably wondering, isn't Ebola confined to the Congo? And why suspect it at all when measles is the likely diagnosis here at home? Back in the 2014 Ebola outbreak, it was successfully contained, and there were only a few Ebola patients who were treated in U.S. hospitals, and concern faded away. But this time, it's a different story. Since the Congo is a war zone, and the population just does not trust efforts to contain the outbreak, and we've seen that evidenced by destruction of Ebola clinics, killing healthcare workers, and folks are just plain avoiding treatment. Well, the outbreak has spun out of control. Now, there does seem to be an effective vaccine, but they're running out of it. And actual counts of infected and dead victims are simply unknown. Get this. It quickly spread from one side of the Congo 1,000 miles away to the other side. So alarm bells are ringing at the World Health Organization, which recently announced that outbreaks of Ebola are the new normal. Another very important difference is the potentially infected population of the Congo is mobile enough to cross the ocean to Mexico and cross the border to enter the United States. Approximately 100 individuals from the Congo are currently being held by Border Patrol. Now, Ebola has an incubation period of up to 21 days. That's long enough to permit long-range, symptomless travel, although the onset usually appears between 4 and 10 days. There's conjecture that the current strain of Ebola Zaire may have the longer incubation period, that the virus has learned something since 2014. Don't kill the host so quickly. Now, that's an interesting speculation indeed. If an infected individual was able to get into the States and make their way to one of our cities that has a large homeless population, for example, Los Angeles, where currently they're burdened with an outbreak of typhus, which is also similar to Ebola in its early manifestations, we'd soon find ourselves very interested in knowing what measles and typhus and Ebola have in common, because to survive Ebola, it has to be recognized very early. Once Ebola's signs and symptoms diverge from those of other diseases, for example, malaria, cholera, typhoid fever, meningitis, other viral hemorrhagic fevers, all of those can resemble Ebola. It could be too late to treat effectively, so the earlier we can differentiate Ebola out of all the other diseases it shares initial symptoms with, the better. Early symptoms shared by measles and Ebola include a fever, a sore throat, headache, aches and pains, gastrointestinal problems, although those are more common in Ebola. And these symptoms are followed by a rash, although not always in Ebola. Now, it's with the appearance of the rash that we spot our first clear difference. In measles, usually it begins in the mouth with something called Koplik spots. They appear about a day before the onset of the skin rash and last for about 2 or 3 days. Those in the mouth are bluish-white, slightly raised, small 2 to 3 millimeter diameter lesions in the mouth. After that, the red measles rash is usually first noted on the face and neck, and by the 3rd day, it spread to the rest of the body. So while measles and Ebola can both have rashes, there's always going to be a rash with measles, but only about half of the people with Ebola develop a rash. It's called a maculopapular rash. That's a flat, red area covered with small bumps It begins about 5 to 7 days after the symptoms began, so it takes a little longer to show up. Then symptoms like vomiting and diarrhea show up, with or without the rash. Now you're not going to see the vomiting and diarrhea in measles, so this is our first major clue. Also, this is when some people begin to bleed, both internally and externally, but not all do. In fact, heavy bleeding is uncommon in Ebola, and if it does happen, it's going to usually be located in the gastrointestinal tract. Now, while there can be death, certainly with measles, in Ebola, it's a much higher death rate, and death can occur due to low blood pressure from fluid loss from about 6 to 16 days after the symptoms appear. So that's pretty quickly. Are there any commonalities in transmission? Now this is somewhat controversial. In measles, we know it's spread through the air or by contact with infectious droplets from the nose, mouth, or throat. In fact, you can contract the disease just by being in the same room as an infected person. However, with Ebola, we're told it can only be transmitted by direct contact with body fluids of an infected individual or surfaces where the virus can live for about 100 hours. Nevertheless, there are experts arguing that airborne transmission may be possible. And for that debate, I'm going to direct you to this area of database. Now this is database 2. There's a database 1 and a database 2. Use database 2. And you see here where I am collecting information about this debate on whether Ebola can be airborne. By the way, I've been tracking Ebola since 2014 in the herbal database, and the current information on it is only in database 2. Now, no one seems to object that infective particles could be breathed in, but they only travel about a meter away from the Ebola victim. And part of the reason for the confidence in stating that it's not airborne is that in humans, Ebola doesn't tend to collect in the lungs to be breathed out. Definitive statements about transmission should be viewed with caution, since it's acknowledged that we don't yet know enough about this strain. Again, you can find all of that in the herbal database. Now, note, and I think this is important, that healthcare workers in full protective garb have contracted the disease just by being in the same room as an infected person. How is that possible? Now, let's turn our attention towards vaccination. Another thing they both have in common now. We know that there's a vaccine for measles as part of the MMR vaccine, and that's credited with halting measles in especially vulnerable populations in third world countries, as well as here. Although in first world countries, improvements in nutrition and sanitation are frequently cited as the reason for fewer cases. And again, in the database, you can look up the measles vaccines for various studies on success, failure, and side effects. And here's a screenshot of part of what you'll find here. Now, as for the Ebola vaccine, it's still new and so far getting rave reviews on its effectiveness for the Zaire strain. But there is a problem. They don't have enough and are currently giving smaller doses to stretch it out before they run out. Nothing really is yet known about side effects, and there's probably much more research necessary to make solid claims on successes or failures. In the case of measles, traditional medicine is very well equipped to deal with it. But Ebola, now that's another matter. Ideally, prompt, qualified medical treatment is accessible. But what if it isn't? Is there anything we can do? Medical researchers are actively looking at what the plant world has to offer. In my next video, I'll show you their results. While you're in the database, be sure to look up how to prepare a sick room if ever you find yourself caring for a highly infectious loved one at home. Also, take a look at preventative hygiene to avoid contagion, and remember to use Database 2 for the most recent information. If you have anything to add, please share in the comments area, and be sure to subscribe to our YouTube channel and newsletter for updates.